Welcome, Dr. Tripathi, at Innovations in Cardiac Therapeutics 2025. Thank you for this interview, sir. And how has been your experience at the Innovations in Cardiac Therapeutics 2025, and what were your major takeaways from the event?
Thank you for asking these questions. In fact, we organized this IICT 25 in the view to impart our colleagues advances in current cardiology and interventions so that we as collectively together can serve the patients in a better way. And the previous experiences have been great. And this time also, I think that there will be great experience and people, all of us will go with the new enlightenment and with newer energy to serve our patients in a better way and to deliver them with the advanced therapeutics.
Okay. So, what are the most transformative innovations in cardiac therapeutics that you see redefining patient outcomes in 2025?
Actually, there is a lot of innovations in the cardiology, uh, particularly intervention cardiology. If we talk about the coronary artery disease, there has been imaging like IVUS and OCT, through which the outcome has been great. Like without OCT and IVUS imaging, if we do the angioplasty, the event rate is almost 12% in 5 years. But if we do in the same way with the IVUS and OCT, event rate comes around to 3 to 4%. It's a huge drop in the event rate. That is why the patient outcome in shorter term and longer term is better. When we come to the hypertension, till now we were talking that hypertension has no permanent solution to it. But now we are performing RDN, this that is renal denervation therapy, which is the permanent treatment for it. If you do it, the patient does not require treatment for a whole life or require minimal therapy throughout their life. And if we talk about the electrophysiology, the BT, AF, and other tachycardias have been challenges in the past. Now we have 3D mapping and ablation that we are doing regularly, and we are coming with the pulse field ablation. Likewise, we are coming with the laser angioplasty as well, which bursts the clot and the CG material which is causing the clogging inside. And patient might not require a stent, the foreign material, and they do better in the future as well. Likewise, there are a lot many things to tell about it, and we will talk as the conference goes on.
Thank you, sir. So, how are the innovations in cardiac care helping reduce procedural risk and recovery time for patients?
See, once we are intervening the patient, it's a collective work, it's a teamwork. Unless our whole team is knowledgeable and know the workflow and they are well trained and they are advanced and well versed with the current therapeutics, we will not be able to deliver the best to the patients. That is why this is an initiative to energize and to impart the knowledge to all our colleagues and since they are partner in the patient care, and that is why we are able to achieve the better outcome in the patients.
Sir, how important is early diagnostics in preventing sudden cardiac arrest, especially among the younger population? As we are seeing, कि younger populations को ज़्यादा attacks आ रहे हैं. So how can we?
Actually, it becomes very painful. I do not like to see the young people like 18 years, 20 years, 25 years on my table. And in fact, it pays me because these are the people who are future for our nation and the family alike. So, so today's their nature of work, which is too tremendous, they are in a tremendous competition. They are eating fast foods and they are going to the gym and eating some like cocktail like things. Those are the things which are contributing to it. So, my message to the newer generation is avoid smoking, go for regular exercise, use the protein which are the naturally available rather than going for protein supplement, and have a work and stress balance so that you can be fit for a longer period of life. And we wish all of you to live 100 years or even beyond that.
So, what major breakthroughs do you anticipate in electrophysiology over the next 5 years?
See, we are coming with a pulse field ablation, which is the permanent ablation for atrial fibrillation, which is going tremendously up with the aging population in our country. Likewise, the VT ventricular tachycardia, which is also going through it. So pulse field ablation will have a major role into it. Likewise, sudden cardiac death, we have a better diagnostics like ELR and loop recorders, which will tell us whether patient is at high risk or not. And some of the patients who have gene and channelopathies, they can be also diagnosed in a much better way and much easier way in the coming years with the more development in the gene amplification and like gene diagnosis.
So,
So
one message you would like to give to the young cardiologists that are attending the event?
So message to them is focus on the patient, focus on your technology, know whatever you are, what are you going to do in the patient, and know exactly what are you going to achieve and what can be negative points and what when we how can we deal it with. Unless you know the complication, how to deal with it, don't do the procedure.
Okay. Thank you so much, sir.
Thank
Thank
you.
you so much for your
Thank you
time.
so much.